Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 9th video of prepared revision course of oral medicine, which is very important for NLE, NRE, NBDE, MDS as well as for BDS students. In this video we complete the whole chapter of bacterial infections, and in this chapter we will cover three important topics. Number one is the necrotizing ulcerative gingivitis. Second is the tuberculosis, and tuberculosis the tubercular ulcer. And third is the syphilis, which is very important, the three types: primary, secondary and tertiary, and its oral manifestation. And we will discuss these all three in this short video. Now first we start from necrotizing ulcerative gingivitis. What is necrotizing? Mean necrosis, and ulcerative there is a ulcer, and gingivitis there is an inflammation of gingiva. Mean there is inflammation of gingiva, and then necrosis occur, and then ulcer occur. Now necrotizing ulcerative gingivitis, short form is NUG, N-U-G, but it is also known as ANUG, ANUG, mean acute necrotizing ulcerative gingivitis. Why it is NUG, also known as ANUG? Because necrotizing ulcerative gingivitis is not present in chronic form. It is only present in acute form. Therefore, NUG is known as ANUG, meaning acute necrotizing ulcerative gingivitis. Now, in necrotizing ulcerative gingivitis, it is an inflammatory destructive disease of the gingiva, which is characterized by: number one, there is a punched out crater-like depression at the crest of the interdental papilla. Here is at the crest of the interdental papilla, mean the part of gingiva which present between two teeth. Here is a crater-like depression, punched out depression. Look at the interdental gingiva, and it is also covered by a white pseudomembrane. Second point is the pseudomembranous slug covering the gingival crater. This crater, the gingival crater, the depression is covered by white sluggy pseudomembrane. Next is the linear erythema demarcating the affected tissue from the remainder of the gingival mucosa. Look at the about the white slugging membrane. There is a erythematous red line, which is a demarcation between normal attached gingiva and interdental affected gingiva. There is a erythema. Next point is that the lesion may extend from, it is not only restricted to interdental papilla, it may involve marginal and attached gingiva, and bone may be exposed. The lesion may extend from interdental papilla to marginal and attached gingiva, and above the because attached gingiva is present above the bone, when they involve the attached gingiva, bone may be exposed. Next is the tissue in contact with the diseased gingiva may be involved. The tissue in contact with the diseased gingiva may be involved. Now, smears from the lesion. When we take smears from the lesion, there will be present scattered bacteria in this smear. In this NUG, predominantly there is a spirochetes and fusiform bacilli. These are the two types of bacteria when we take smear from the lesion of the NUG. Next is that the lesion extends from interdental papilla to marginal and attached gingiva and may expose alveolar bone. The contact surface of tissue of tongue, cheeks, lip may be involved. Mean the surfaces which contact the gingiva, like tongue, contact surface, cheek, lips may be involved. This is all about ANUG or neck. Now come to the second bacterial infection in oral medicine is a tuberculosis. It is a disease caused by Mycobacterium tuberculosis and is characterized by granuloma, because in tuberculosis the granuloma formation in any organ in the body but usually affects the lungs. Oral lesion secondary to pulmonary tuberculosis and frequently begin as a small tubercle. Mean the oral lesion which occur in tuberculosis patient secondary to pulmonary tuberculosis, first the lesion is small, begin as small tubercle that break down to form a painful ulcer. After tubercle, when they break down, then they form a painful ulcer. The ulcer commonly involve the tongue and characterized by, look at here, the tubercular ulcer on tongue, mean interior, the tip of the tongue, there is a tubercular ulcer because mainly involve the tongue. And how they look like? Chronic, these are chronic, painful, indurated ulcer with irregular undermined edges and thick mucosal material in the base. This is the chronic ulcer, painful ulcer, and irregular border. And there is a thick mucous material in the base. Look at it in the base. Base is not red, but base is, border is red, but base is the have thick mucus material. This is about tubercular ulcer, which initially formed as a tubercle, then break down to form chronic indurated ulcer with irregular undermined edges and thick mucous material in the base. Now come to the third, which is very, very important, syphilis. In last time NLE exam, the MCQs was come. Guma occur in which type of syphilis? Primary, secondary and tertiary. Actually is a tertiary. And next MCQ was come, canker occur in which type of syphilis? There is a primary syphilis. And the third question was come is the Hutchinson teeth are present in which type of infection? Actually there was a syphilis. Now we come to the detail of syphilis. What is syphilis? It is an infectious disease caused by Treponema T. pallidum, and because it is a bacteria, and it is characterized by numerous systematic manifestations that appear in three general stages over months to year. I mean there are three stages of syphilis from months to years. First stage is the primary syphilis, second is the secondary syphilis, third is the tertiary syphilis. Now first is the primary syphilis. In primary syphilis, the lesion which is formed mainly on the lip, which is canker. This is a canker. In primary syphilis, the oral lesion of primary syphilis is contagious and known as canker. It is less typically intraorally due to moisture, trauma and microbial flora, where it is covered by grayish white film. Grayish white film covered by, here is a grayish white film over the ulcer. And ulcer is painful with a raised margin. Look at the ulcer is painful with a raised margin on the vermilion border of the lip. Here is the on the vermilion border of the lip. It is identical to genital canker. When in genitalia's canker occur, same it is identical. It is painless round ulcer with a raised margin, indurated base and covered by mean the primary syphilis when occur on the lip, it is painful, but when present on the vermilion mean on the vermilion border of the lip. It is identical to genital canker, but genital canker is a round ulcer with raised margin and indurated base and covered by hemorrhagic crust, and it is a painless. The local lymph node are in primary syphilis. The local lymph nodes are enlarged, rubbery and painless, and canker persists for 3 to 8 weeks. Mean the important things in syphilis is the first, it is caused by T. pallidum. Third, there are 3 stages which occur from months to 2 years. Third, in primary syphilis, there is a canker formed which formed on the vermilion border of the lip. Third is the primary syphilis persist. The canker of primary syphilis persists for 3 to 8 weeks. And in primary syphilis, the local lymph node are enlarged, rubbery and painless. Now come to the secondary syphilis. The lesion of the oral secondary syphilis are contagious and may appear as ulcer in the form of mucus patches and papules. Look at your diagram. This is the secondary syphilis which appear as a patches and papules. The mucus patches are covered by mucoid exudate and surrounded by erythematous zone. Mean the outer border is red and inside there is a mucus-like exudate. Ulceration on the palate and tonsil shows snail track pattern. Mean ulceration on the palate and tonsil. Look at the tonsillar area and palate. They represent the snail track pattern. This is the important things. Remember, in secondary syphilis, papules and patches occur and they represent snail track pattern. These 2 things are the important in the secondary syphilis. Now come to the tertiary syphilis. In tertiary syphilis, the ulcer which is formed is known as gumma. Gumma start as small firm nodular mass enlarged to several centimeters in diameter, followed by necrosis and produce and oral ulceration. It is painless, sharply demarcated, punched out ulcer, healing after several months. The oral lesion of tertiary syphilis is not contagious. The oral lesion of primary and secondary is contagious, but tertiary is not contagious and most frequently involve the palate and tongue. In palate, tertiary syphilis mainly involve the palate and tongue. In palate, gummatous destruction of the palatal bone. When gumma destroy the palatal bone is known as cause of perforation of the palate. The known cause of in perforation of the palate, the known cause is the gummatous. These gumma destroy the palatal bone. Look at initially in palate the gumma is formed. This is the gumma and at the end they will perforate the palate. Now on the tongue, the chronic ulcerated gumma manifests as solitary, deep punched out ulcer. This is about tertiary syphilis. In tertiary syphilis, the important thing is gumma, painless, it is not contagious, and it's mainly involved palate and tongue. In palate, the known cause of palatal perforation is the gumma. Next thing which was MCQs come in March annual exam, this is the Hutchinson teeth. It is occur in syphilis, and in Hutchinson teeth, the biting surface of the teeth is have notches. Look at all teeth. The biting surface means incisal and exorsal surfaces of the teeth have these have notch like teeth. This is occur in syphilis lesion. Now this is all about today lecture, main bacterial infection, in which we discussed about acute necrotizing ulcerative gingivitis, tubercular ulcer, and syphilis and types of syphilis. Now today our chapter is complete. In next video, we will discuss about viral infections in detail. Now, if you like my video, press the like button and share this video with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.